If you're over 60 and worried about blood pressure, this channel is built for you. We explain what doctors often don't have time to explain. Subscribe now, the next videos continue this exact topic. For many people over the age of 60, there is a specific time of night that feels different from all the others. It is quiet, the house is still, the world outside seems asleep, and yet, inside the body, something changes. Between 3 and 5 in the morning, many seniors wake up suddenly. Sometimes it is with a racing heart, sometimes with a sense of pressure in the chest, sometimes with anxiety that seems to come from nowhere. Others wake simply feeling alert, unable to fall back asleep, with a strange sense that something is off. When blood pressure is measured at this time, the numbers can be alarming, higher than expected, higher than earlier in the night, sometimes higher than daytime readings. This experience is deeply unsettling. It often triggers fear. Many people wonder if they are in danger, if something is about to happen, or if they should change their medication immediately. What makes this moment even more frightening is that it feels unpredictable. You may go to bed feeling fine, sleep peacefully for several hours, and then, without warning, your body shifts. The calm of the night is broken by alertness, tension, or concern. This video exists to explain why that happens. The rise in blood pressure between 3 and 5 in the morning is not random. It is not imaginary. And in most cases, it is not a sign that something has suddenly gone wrong. It is the result of the body's internal systems changing gears. After 60, these changes become more noticeable. The body is still doing what it has always done, but the transitions are sharper, slower, and less forgiving. Understanding what happens during this window of time can remove much of the fear that surrounds it. Blood pressure is not a static number. It follows rhythms. These rhythms are influenced by hormones, the nervous system, sleep stages, and the internal clock that governs when the body prepares to wake. Between 3 and 5 in the morning, that internal clock begins to shift. The body starts moving from deep nighttime regulation toward early morning readiness. This process begins long before you open your eyes or get out of bed. It happens quietly, inside the nervous and hormonal systems. In younger adults, this shift is smooth. Blood vessels adjust gradually. The heart responds calmly. Blood pressure rises gently toward morning levels. After 60, the same shift can feel more dramatic. Blood vessels are less flexible. The nervous system is more reactive. Hormonal signals can overshoot instead of rising gradually. The result is a temporary spike in blood pressure that feels sudden and intense. This is often accompanied by physical sensations. You may feel your heart beating more strongly. Breathing may feel shallow. Thoughts may become more active. Anxiety may appear without an obvious cause. These sensations can make the situation feel urgent, even dangerous. It is important to understand that this response is not purely psychological. It is physiological. The body is responding to internal signals that say, "Prepare to wake." After 60, the body may prepare too aggressively. This does not mean the body is failing. It means regulation has become less precise. Many seniors assume that if blood pressure rises at night, it must be due to something they did wrong, something they ate, something they forgot, a medication problem. Sometimes these factors contribute. Often, they do not. The 3 to 5 a.m. window is unique because it is when multiple systems change at once. Hormones that support alertness begin to rise. The nervous system shifts its balance. Blood pressure naturally starts moving upward from its lowest nighttime point. When these changes overlap too strongly, blood pressure can spike. This spike is often brief. It may settle on its own as the body completes its transition. But because it happens during a quiet, vulnerable moment, it feels more intense. Silence amplifies sensation. When the world is quiet, the body's signals become louder. Many seniors make the mistake of measuring blood pressure immediately upon waking during this window. Seeing a high number reinforces fear. Fear activates the nervous system further. Blood pressure rises again. A feedback loop begins. This loop can turn a temporary physiological adjustment into a prolonged period of anxiety and instability. Understanding breaks the loop. When you know that the body is transitioning, not malfunctioning, your response changes. Calm replaces panic. The nervous system settles more quickly. Blood pressure stabilizes. This does not mean that nighttime blood pressure spikes should always be ignored. It means they should be understood in context. Context matters more after 60. Without context, numbers create fear. With context, numbers become information. This video is designed to provide that context. We will explain what the internal clock is doing during this time. We will talk about hormones that rise before morning. We will explore how the nervous system behaves after 60, especially during sleep transitions. We will also discuss how sleep quality, breathing, and nighttime habits influence this early morning window. Most importantly, we will talk about what actually helps. Not quick fixes, not drastic changes, not panic-driven decisions, but calm, supportive habits that reduce the intensity of these spikes over time. This video is not meant to replace medical care. It does not suggest stopping medication or making changes without guidance. Instead, it gives you a framework for understanding your body. Understanding is power. When seniors understand why something happens, they stop reacting with fear. Fear is one of the strongest triggers for blood pressure spikes. Reducing fear is often the first step towards stability. If you have ever woken up between 3 and 5 in the morning feeling unsettled, this video is for you. If you have ever measured blood pressure at that hour and felt alarmed by the result, this video is for you. If you have ever wondered why mornings feel harder than they should, this video is for you. The body is not betraying you in the early morning hours. It is following patterns that change with age. Once you understand those patterns, you can work with them instead of against them. In the next part of this video, we will begin by looking at the body's internal clock and how its timing shifts after 60, setting the stage for early morning blood pressure changes. Every cell in the human body follows a clock. This clock is not something you can see or feel directly, but it quietly governs when hormones rise, when blood vessels relax, when heart rate slows, and when blood pressure begins to change. This internal timing system is known as the circadian rhythm. For much of adult life, the circadian rhythm works smoothly in the background. You feel sleepy at night. You feel alert in the morning. Blood pressure lowers during sleep and rises gradually toward daytime levels. These shifts feel natural and predictable. After the age of 60, this rhythm begins to change. The clock does not disappear. It becomes less precise. This loss of precision is one of the most important reasons blood pressure spikes occur between 3 and 5 in the morning. The circadian rhythm is regulated by a small group of cells in the brain that respond to light, darkness, and daily habits. These cells coordinate timing signals throughout the body. They tell organs when to rest and when to prepare for activity. In younger adults, these signals are strong and well synchronized. Different systems respond together, like musicians following the same conductor. After 60, the signals weaken slightly, and the coordination becomes less exact. Some systems respond early, others respond late. The result is overlap. Between 3 and 5 in the morning, this overlap becomes most noticeable. This is the time when the body begins transitioning from deep nighttime regulation toward early morning readiness. Blood pressure is naturally programmed to start rising during this window. This rise prepares the body for waking, standing, and movement. In a well-regulated system, the rise is gradual. After 60, the rise can be uneven. Blood vessels may stiffen before the heart is ready. Hormones may surge before the nervous system has settled. The internal clock sends mixed signals, and blood pressure responds with a spike rather than a smooth climb. This is not a malfunction. It is a timing issue. The circadian rhythm also influences how sensitive the body is to stress signals. In the early morning hours, sensitivity increases. Small stimuli that would be ignored during the day can produce a stronger response at night. This is why anxiety often feels sharper between 3 and 5 a.m. The mind may become active even when there is nothing to think about. Thoughts feel louder. Worries feel heavier. This mental activation feeds directly into the nervous system, which influences blood pressure. After 60, the boundary between mental and physical responses becomes thinner. The circadian rhythm also interacts with sleep stages. During the night, the body cycles through different phases of sleep. Deep sleep supports blood pressure, lowering, and cardiovascular recovery. Lighter sleep phases are more sensitive to internal and external disturbances. Between 3 and 5 in the morning, many people naturally move into lighter sleep. This makes the body more aware of internal changes. If blood pressure begins to rise during this time, it is more likely to be felt. You may wake suddenly, Your heart may feel more present. Breathing may feel different. These sensations draw attention to the body, reinforcing alertness. This feedback loop can amplify the spike. Another important change after 60 is reduced adaptability. Earlier in life, the circadian system could adjust quickly if timing was slightly off. Late nights, irregular schedules, or poor sleep could be compensated for the next day. After 60, compensation is slower. The internal clock becomes more dependent on routine. When routines are inconsistent, the clock drifts. When the clock drifts, timing errors increase. These timing errors are most obvious in the early morning hours. This is why seniors who go to bed at different times each night or wake at inconsistent hours often experience more pronounced early morning blood pressure changes. The body does not know exactly when to begin its transition. It may start too early, too strongly, or in a fragmented way. Light exposure also plays a role in circadian shifts. Artificial light in the evening delays the clock. Darkness signals allow it to reset. After 60, the clock relies more heavily on these cues because internal signals are weaker. When evening light exposure is high, the clock may delay nighttime processes. When darkness finally arrives, the system tries to catch up. This delayed and compressed transition can push the early morning rise in blood pressure into a narrower window, making it feel more abrupt. It is important to understand that circadian shifts affect everyone differently. Some seniors experience clear spikes. Others feel only subtle changes. Genetics, lifestyle, sleep quality, and overall health all influence how pronounced the effect becomes. What they share is vulnerability during the same time window. Between 3 and 5 a.m., the body is neither fully asleep nor fully awake. It is changing states. State changes are when instability occurs. This is true in many systems, not just the cardiovascular system. Temperature regulation, blood sugar, and hormone levels also shift during this time. Blood pressure responds to all of these changes at once. Understanding the role of the internal clock helps remove the mystery from early morning blood pressure spikes. It explains why the same person can feel fine at midnight, wake with tension at 4 a.m., and feel normal again by morning. The body is not unpredictable. It is following a rhythm that has become less smooth with age. The goal is not to fight the circadian rhythm. It is to support it. Supporting the internal clock means reinforcing consistent signals, regular sleep timing, calm evenings, reduced stimulation before bed, gentle mornings. These signals help the clock regain some of its lost precision. Over time, the early morning transition becomes smoother. Blood pressure rises more gradually. Waking feels less abrupt. This does not eliminate all spikes, but it reduces their intensity and frequency. If there is one idea to take from this part of the video, it is this. The 3 to 5 a.m. blood pressure spike is a timing issue, not a sudden failure. The internal clock is changing gears. When you understand that, you stop reacting with fear. Fear itself disrupts timing further. Calm supports correction. In the next part of this video, we will explore the role of cortisol and adrenaline, the hormones that drive the early morning surge, and why their effects become stronger after 60. As the body moves through the night, it does not remain in a single state. Even while you sleep, powerful chemical signals are rising and falling, preparing the body for what comes next. Among the most important of these signals are two hormones that strongly influence blood pressure: cortisol and adrenaline. Together, they drive what is known as the morning surge. The morning surge is a normal physiological process. It exists to help the body wake up, become alert, and prepare for movement. Blood pressure rises, heart rate increases slightly, and blood vessels adjust to support standing and activity. In younger adults, this surge is smooth and controlled. After the age of 60, the same surge can become exaggerated. Cortisol is often called the stress hormone, but this name is misleading. Cortisol is not harmful by nature. It plays an essential role in regulating energy, metabolism, and blood pressure. In the early morning, cortisol rises to signal that the body should begin waking. This rise typically begins hours before you are conscious of it. Between 3 and 5 in the morning, cortisol levels naturally increase. This increase helps raise blood pressure gently, ensuring that blood flow to the brain is adequate when you wake and stand. Adrenaline works alongside cortisol. It supports alertness, responsiveness, and cardiovascular readiness. Together, these hormones prepare the body for the day ahead. After 60, the body's response to these hormones changes. Blood vessels become less flexible. Receptors that respond to hormonal signals may become more sensitive or less balanced. As a result, the same hormonal increase produces a stronger effect. Instead of a gradual rise in blood pressure, the surge becomes sharper. This sharper surge is often felt physically. You may wake with a pounding heart. You may feel tense or restless. Breathing may feel shallow. Thoughts may race. These sensations can appear suddenly and feel intense. Because they occur during a quiet moment, they draw attention and create concern. It is important to understand that cortisol and adrenaline do not rise because something is wrong. They rise because the body is following its internal schedule. The issue is not the presence of these hormones. It is the body's reduced ability to buffer their effects. After 60, the buffering systems are less efficient. The nervous system plays a key role here. Cortisol and adrenaline are regulated by the nervous system. When the nervous system is calm, their effects are moderated. When the nervous system is already alert or sensitive, their effects are amplified. This is why sleep quality and evening habits matter so much. If the nervous system enters the night already overstimulated, cortisol and adrenaline act on a system that is primed to react. Blood pressure rises more abruptly. If the nervous system enters the night calm and settled, the same hormonal rise is absorbed more smoothly. Another factor is the timing of hormone release. After 60, the timing of cortisol release can shift earlier. Instead of peaking closer to waking, it may rise while you are still deeply asleep. This can cause premature alertness and wakefulness. When cortisol rises before the body is ready to wake, it can disrupt sleep and raise blood pressure at an awkward time. This early rise is one reason many seniors wake between 3 and 5 a.m., feeling alert or anxious without understanding why. Adrenaline also becomes more influential with age. As blood vessels stiffen, adrenaline's effects on heart rate and vessel tone become more pronounced. Small increases in adrenaline produce larger cardiovascular responses. This is why early morning awakenings may feel dramatic even when the underlying hormonal change is modest. The body is reacting strongly to a normal signal. Many seniors interpret this reaction as danger. The fear response that follows further increases adrenaline, creating a second wave of elevation. This secondary surge is often more problematic than the first. Understanding this process helps interrupt the cycle. When you recognize that the initial surge is hormonal and temporary, you are less likely to panic. Reduced panic means reduced adrenaline. Blood pressure settles more quickly. This is not about ignoring symptoms. It is about responding appropriately. It is also important to understand that cortisol and adrenaline are influenced by lifestyle. Chronic stress, poor sleep, irregular routines, and evening stimulation all affect how these hormones behave at night. After 60, the body has less reserve to compensate for these influences. Late meals, alcohol, caffeine, and bright light can all shift hormone timing. Emotional stress can increase baseline adrenaline. Inconsistent sleep schedules can confuse cortisol rhythms. All of these factors increase the likelihood of a pronounced morning surge. Medication timing can also interact with hormonal patterns. Some blood pressure medications are designed to blunt the morning surge. If timing is off, their protective effect may be reduced during the early morning hours. This does not mean medication is failing. It means alignment matters. Discussing early morning symptoms with a healthcare provider can help determine whether medication timing should be adjusted. However, understanding the hormonal basis of the surge is essential before making changes. The goal is not to suppress cortisol or adrenaline completely. That would be harmful. The goal is to smooth their effects. Smoothing comes from supporting the nervous system, improving sleep quality, and maintaining consistent routines. It also comes from how you respond when you wake during this window. Sudden movement, bright light, checking blood pressure immediately, or engaging in stressful thoughts all amplify the surge. Calm responses help it pass. Simple actions such as slow breathing, staying still for a moment, and avoiding immediate stimulation allow the body to complete its transition. Many seniors report that when they stop fighting the early morning surge and instead allow it to settle, episodes become shorter and less intense over time. This does not happen overnight. It happens through repeated calm responses. Over weeks and months, the nervous system learns that the early morning hormone rise is not a threat. Reactivity decreases. Blood pressure becomes more stable. If there is one idea to take from this part of the video, it is this. The morning surge is driven by hormones that are doing their job. After 60, the job becomes harder. The solution is not to fear the surge, but to reduce the factors that make it overshoot. In the next part of this video, we will explore how the nervous system itself becomes more unstable after 60 and why this instability makes early morning blood pressure spikes feel stronger and more frightening than they truly are. After the age of 60, one of the most important changes in the body is not always visible on scans or blood tests. It is a change in how the nervous system regulates balance between calm and alertness. This change plays a central role in why blood pressure spikes feel stronger, more sudden, and more frightening between 3 and 5 in the morning. The nervous system has two main branches that work together to maintain balance. One branch prepares the body for action, alertness, and response. The other supports rest, recovery, and regulation. In a healthy system, these two branches communicate constantly, adjusting smoothly to changing conditions. Earlier in life, this balance is resilient. If one branch becomes more active, the other responds quickly to counterbalance it. Blood pressure rises and falls within a narrow, controlled range. The system self-corrects. After 60, this balance becomes less stable. The nervous system does not lose its ability to regulate, but it becomes more sensitive and less precise. Small signals produce larger reactions. Transitions become harder to smooth out. This is especially noticeable during state changes when the body moves from deep sleep to lighter sleep, from rest toward waking. Between 3 and 5 in the morning, the nervous system is in the middle of such a transition. During this window, the branch responsible for alertness begins to activate. At the same time, the branch responsible for calm should still be active, keeping the system stable. After 60, this overlap does not always work as intended. Instead of a smooth handoff, both branches may activate at once. This creates instability. When alertness signals rise too quickly and calming signals lag behind, the body experiences a surge of activity without adequate restraint. Heart rate increases. Blood vessels tighten. Blood pressure rises abruptly. This response is not deliberate, it is automatic. The nervous system is reacting to internal timing signals, not external danger. However, the body cannot distinguish between internal and external threats. It responds as if action is required. This is why early morning blood pressure spikes often come with physical sensations of anxiety. You may feel tense, restless, or uneasy. Your heart may feel loud or fast. Breathing may become shallow. Thoughts may race. These sensations feel emotional, but they are rooted in physiology. After 60, the nervous system's threshold for activation is lower. What once required a strong trigger now requires only a mild one. Hormonal shifts, sleep transitions, or subtle discomfort can activate alertness pathways. At the same time, the calming pathways that should counteract this activation respond more slowly. This delay is critical. The longer alertness remains unopposed, the higher blood pressure rises. Many seniors interpret these sensations as warning signs of impending danger. This interpretation is understandable. The body feels activated, and the mind searches for a reason. Fear becomes the reason. Fear then feeds back into the nervous system, increasing activation further. A loop forms. This loop can turn a temporary physiological adjustment into a prolonged episode of distress. Understanding nervous system instability helps break this loop. When you recognize that the nervous system is temporarily overreacting, you are less likely to add fear to the equation. Reduced fear allows calming pathways to catch up. This does not eliminate the initial spike, but it shortens its duration. Another important aspect of nervous system instability after 60 is reduced recovery speed. Earlier in life, the nervous system could activate and then settle quickly. After 60, settling takes longer. Once alertness is triggered, it may linger. This is why early morning awakenings can lead to hours of restlessness. The body remains in a state of readiness even when there is nothing to respond to. Sleep quality plays a major role here. Fragmented or shallow sleep increases nervous system sensitivity. Each awakening resets the system toward alertness. Over the course of the night, This creates cumulative instability. By the time the 3 to 5 a.m. window arrives, the nervous system is already primed. Conditions such as sleep apnea further increase this effect. Repeated interruptions in breathing activate alertness pathways. Oxygen fluctuations stress the nervous system. Blood pressure becomes more variable. Not all seniors with early morning spikes have sleep apnea, but many have some degree of sleep fragmentation that contributes to instability. Chronic stress also shapes nervous system behavior. Long-term stress changes baseline activation levels. The nervous system becomes accustomed to operating at a higher alert level. At night, it has difficulty fully disengaging. After 60, the ability to turn off stress responses diminishes. This does not mean stress cannot be managed. It means it must be managed more deliberately. The nervous system is highly responsive to signals of safety. Darkness, quiet, warmth, slow breathing, and familiar routines all signal that vigilance is unnecessary. When these signals are present consistently, the nervous system learns to settle more reliably. This learning takes time. One of the most common mistakes seniors make is trying to suppress nervous system responses. They tell themselves to calm down. They try to force sleep. They fight the sensations. Resistance increases tension. The nervous system responds best to allowance rather than control. When early morning activation occurs, allowing the body to remain still, breathing slowly, and avoiding immediate stimulation helps the system recalibrate. Turning on bright lights, checking devices, or measuring blood pressure immediately reinforces alertness. The nervous system interprets these actions as confirmation that something is wrong. Gentle responses send the opposite message. Over time, these responses retrain the nervous system. Repeated calm reactions during early morning awakenings teach the system that this state change is not dangerous. The threshold for activation gradually increases. Spikes become less intense. This is not a quick fix. It is a process of conditioning. After 60, conditioning works in both directions. The nervous system can become more reactive, but it can also become more stable with the right cues. This is an important message. Nervous system instability is not permanent damage. It is a state influenced by habits, routines, and responses. Supporting the nervous system is one of the most effective ways to stabilize blood pressure in the early morning hours. If there is one idea to take from this part of the video, it is this. Early morning blood pressure spikes are amplified by a nervous system that is temporarily unstable. The instability is not a failure. It is a sensitivity. Sensitivity can be supported. In the next part of this video, we will explore how sleep quality issues such as shallow sleep, breathing disturbances, and nighttime awakenings further contribute to blood pressure spikes between 3 and 5 a.m., and how recognizing these patterns can guide safer responses. Many seniors watch one video and stop. That's a mistake. Blood pressure problems after 60 are connected. If you want the full picture, subscribe so you don't miss the next part. For many seniors, the conversation about blood pressure focuses on numbers measured while awake. What often goes unnoticed is what happens during sleep itself. Sleep quality plays a critical role in how blood pressure behaves throughout the night, especially during the early morning hours between 3 and 5 a.m. Sleep is not a uniform state. It moves through stages, each with different effects on the heart, blood vessels, and nervous system. Deep sleep supports blood pressure lowering and cardiovascular recovery. Light sleep and fragmented sleep do not provide the same protection. After the age of 60, deep sleep naturally becomes shorter and less frequent. The body spends more time in lighter stages of sleep, which are more sensitive to internal changes. This shift alone increases vulnerability to nighttime blood pressure instability. When sleep is deep and continuous, blood pressure remains low and steady. Blood vessels relax. Heart rate slows. The nervous system stays balanced. This is when the cardiovascular system recovers from the strain of the day. When sleep is shallow or interrupted, this recovery is incomplete. Each awakening, even if brief, activates the nervous system. Heart rate increases. Blood vessels tighten slightly. Blood pressure rises. If these awakenings occur repeatedly, blood pressure may remain elevated throughout the night. Between 3 and 5 a.m., this effect becomes more pronounced. This is the time when sleep naturally becomes lighter, even in healthy individuals. For seniors with fragmented sleep, this transition is more abrupt. The body moves out of deep sleep without adequate buffering. Blood pressure responds with a spike rather than a gentle rise. Many seniors are unaware of how fragmented their sleep actually is. You may feel as though you slept through the night, but brief awakenings often go unnoticed. These micro-awakenings are enough to activate the nervous system and disrupt blood pressure regulation. One of the most important contributors to sleep fragmentation after 60 is sleep-disordered breathing, including sleep apnea. Sleep apnea involves repeated pauses in breathing during sleep. These pauses may last only a few seconds, but they have significant physiological effects. Oxygen levels drop. The nervous system reacts. Heart rate increases. Blood pressure rises. These events can occur dozens of times per hour without full awakening. Each breathing pause triggers a stress response. The body reacts as if it needs to protect itself. Adrenaline is released. Blood vessels constrict. Blood pressure spikes. Over the course of the night, these repeated responses create instability between 3 and 5 a.m. When sleep is lighter and hormonal changes are underway, the effects of sleep apnea become even more noticeable. Blood pressure spikes may coincide with awakenings, palpitations, or a sense of shortness of breath. Not all seniors with early morning blood pressure spikes have diagnosed sleep apnea. However, even mild breathing disturbances can influence nighttime blood pressure. Snoring, gasping, waking with a dry mouth, morning headaches, or unexplained fatigue can be subtle signs that sleep quality is compromised. After 60, the threshold for symptoms becomes lower. The cardiovascular system reacts more strongly to sleep disturbances that might have been tolerated earlier in life. It is also important to recognize that sleep quality is influenced by factors beyond breathing. Pain, discomfort, frequent urination, restless legs, and environmental disturbances all fragment sleep. Each interruption triggers a small stress response. Individually, these responses may seem insignificant. Collectively, they add up. When the nervous system is repeatedly activated at night, it enters the early morning hours already sensitized. Blood pressure responds with exaggerated changes. Many seniors notice that nights with poor sleep are followed by mornings with higher or more erratic blood pressure readings. This pattern is not coincidence. Sleep quality sets the tone for blood pressure regulation. Another overlooked aspect of sleep quality is position. Sleeping on the back can worsen breathing disturbances for some individuals. It can increase airway collapse and reduce oxygen flow. Side sleeping often improves breathing and reduces nervous system activation. Elevating the head slightly can also support airway openness and reduce nighttime blood pressure fluctuations. These adjustments are not cures, but they can reduce the burden on the cardiovascular system. It is important to approach sleep quality with curiosity rather than alarm. Not every early morning awakening indicates a serious disorder. Not every blood pressure spike is dangerous. The goal is to understand patterns, not to diagnose yourself. If early morning spikes occur frequently and are accompanied by symptoms such as extreme fatigue, loud snoring, or breathing difficulties, discussing sleep quality with a healthcare provider. Sleep studies can provide valuable information, but even without formal testing, awareness of sleep quality can guide supportive habits. Improving sleep quality often leads to more stable nighttime blood pressure. Calmer evenings, consistent sleep schedules, reduced stimulation, and comfortable sleep environments all support deeper sleep. When sleep deepens, the nervous system calms. When the nervous system calms, blood pressure stabilizes. This relationship is powerful. Many seniors are surprised to find that focusing on sleep quality reduces early morning blood pressure spikes more effectively than focusing on numbers alone. This is because sleep is when the body performs maintenance. Without adequate maintenance, systems wear down. After 60, maintenance becomes more important than performance. It is also worth noting that sleep quality changes gradually. Improvements may take weeks rather than days. This is normal. The body needs time to relearn how to rest deeply. Patience is part of the process. If there is one idea to take from this part of the video, it is this. Blood pressure spikes between 3 and 5 a.m. are often a sign that the body did not rest as deeply as it needed to earlier in the night. Improving sleep quality reduces the need for the body to react so strongly. In the next part of this video, we will discuss why measuring blood pressure during the 3 to 5 a.m. window can be misleading. and how understanding timing and context can prevent unnecessary fear and overreaction. For many seniors, the moment they wake up between 3 and 5 in the morning, the first instinct is to check blood pressure. The house is quiet. The body feels different. The mind is alert. Measuring feels like the responsible thing to do. But this is often the worst possible moment to measure blood pressure. Not because the reading is fake, but because it is taken out of context. Blood pressure numbers are not isolated facts. They are snapshots taken during a specific physiological state. When that state is unstable, the snapshot can be misleading. Between 3 and 5 a.m., the body is in transition. It is not fully asleep. It is not fully awake. The nervous system is shifting gears. Hormones are changing. Blood vessels are adjusting. Heart rate is fluctuating. Measuring blood pressure during this transition captures a moment of instability rather than a true baseline. After 60, this instability becomes more pronounced. Earlier in life, the body could move through transitions smoothly. Blood pressure rose and fell gently. A reading taken during the night might still resemble daytime values. After 60, transitions are sharper. Blood pressure can spike briefly and then settle again within minutes. When you measure during the spike, you see the peak but not the recovery. This creates a distorted picture. Many seniors assume that the number they see represents their true blood pressure. In reality, it may represent a temporary surge driven by hormones, nervous system activation, or sleep disruption. This is why early morning readings often look worse than readings taken later in the morning. The act of measuring itself can also influence the result. Waking suddenly and reaching for a blood pressure cuff activates the nervous system. Sitting up quickly changes circulation. Tightening the cuff can create physical tension. Anticipation and worry increase adrenaline. All of these factors push blood pressure higher. After 60, the body responds more strongly to these stimuli. What begins as a moderate surge can become a more dramatic spike simply because attention has been drawn to it. Another problem with measuring at this hour is interpretation. Seeing a high number at 3 or 4 a.m. often triggers fear. Fear is a powerful physiological response. It activates alertness pathways and increases blood pressure further. This creates a loop. The number causes fear. Fear raises blood pressure. The next measurement is even higher. Soon, the body is fully awake, anxious, and far from its resting state. The original surge might have resolved on its own if left undisturbed. This does not mean that blood pressure should never be measured at night. There are clinical situations where nighttime measurements are important. However, these measurements are usually taken with ambulatory monitors that record values without waking the person or triggering stress responses. Self-measurement during spontaneous awakenings is different. It introduces awareness, movement, and emotion, all of which alter the result. Another issue is expectation. If you wake up expecting a high reading, your body prepares for it. The nervous system anticipates threat. Blood pressure rises before the cuff is even inflated. After 60, expectation has a stronger physiological effect. This is why repeated early morning measurements can make the problem feel worse over time. The body learns to associate waking at this hour with stress. The timing of measurement matters greatly for accurate assessment. Most healthcare providers recommend measuring blood pressure after waking for the day, once the body has had time to stabilize. Sitting quietly for several minutes, breathing normally, and avoiding stimulation produces a more meaningful reading. This reading reflects how the cardiovascular system functions in a steady state. Nighttime readings taken during transitions reflect reactivity, not baseline control. Understanding this distinction is critical. Many seniors worry that early morning spikes mean their medication is failing. They consider adjusting doses or timing on their own. This can create further instability. Medication decisions should be based on patterns, not isolated readings. Patterns require consistent measurement conditions. This is why healthcare providers look at trends over time, rather than single numbers. If early morning spikes occur frequently and are accompanied by concerning symptoms, they should be discussed with a provider. However, the discussion should include context, sleep quality, timing, stress levels, and habits. Without context, numbers are misleading. It is also important to recognize that blood pressure naturally rises before waking. This rise is part of the body's preparation for standing and movement. A moderate increase is expected. The problem is not the rise itself, but the intensity and timing. Measuring during the peak exaggerates the perceived problem. A helpful approach is to delay measurement. If you wake between 3 and 5 a.m., allow the body to remain still. Focus on slow breathing. Avoid bright light. Let the nervous system settle. If you fall back asleep, measure blood pressure later in the morning under calm conditions. Many seniors find that readings taken later are significantly lower than those taken during the early morning window. This difference is not deception. It is physiology. Another important point is that blood pressure targets are based on daytime readings. They are not designed to evaluate transient nighttime surges. Judging health based on numbers taken during a vulnerable transition creates unnecessary worry. This worry itself becomes a risk factor. After 60, emotional responses have a stronger effect on cardiovascular regulation. Reducing unnecessary alarm is part of protecting health. If there is one idea to take from this part of the video, it is this. A number without context is not information, it is noise. Measuring blood pressure between 3 and 5 a.m. often captures noise. Understanding when and how to measure gives numbers meaning. In the final part of this video, we will bring everything together and explain how to reduce early morning blood pressure spikes safely by supporting the body's rhythms rather than chasing numbers in the dark. By now, it should be clear that blood pressure spikes between 3 and 5 in the morning are not random events. They are the result of several systems changing at the same time. The internal clock begins to shift. Hormones rise. The nervous system becomes more alert. Sleep grows lighter. After 60, these transitions are less smooth. The good news is that reducing early morning blood pressure spikes does not require extreme measures. It does not require fighting the body. It requires supporting the body's natural rhythms so that these transitions become gentler. Safety comes from cooperation, not control. The first and most important principle is to reduce nervous system reactivity before the spike occurs. What happens at 3 or 4 in the morning is strongly influenced by what happened the evening before. Calm evenings lead to calmer early mornings. Stimulating evenings lead to reactive ones. This means that the most effective way to reduce early morning spikes often begins hours earlier. Creating a predictable, calming evening routine helps the nervous system enter the night in a settled state. When the nervous system is calm at bedtime, it responds more smoothly to hormonal changes later in the night. This does not require perfection. Consistency matters more than intensity. Dim lighting, reduced screen use, gentle activities, and familiar routines all send the same message. Vigilance is no longer required. The second principle is to support sleep quality. Deep, continuous sleep buffers the body against early morning instability. Fragmented sleep removes that buffer. Improving sleep quality does not mean forcing sleep. It means reducing obstacles. Comfortable sleep environments, consistent sleep timing, supportive pillows, and attention to breathing all help the body rest more deeply. If breathing disturbances are suspected, addressing them with a healthcare provider can make a meaningful difference. Even small improvements in oxygen flow reduce nighttime stress on the cardiovascular system. The third principle is to respond calmly when you wake during the 3 to 5 a.m. window. This moment is critical. When you wake and feel alert or unsettled, your response determines whether the spike escalates or settles. Sudden movement, bright lights, checking devices, or measuring blood pressure immediately all increase alertness. They confirm to the nervous system that something is wrong. A safer response is stillness. Remain lying down or seated comfortably. Keep the environment dim. Focus on slow, steady breathing. Allow the body time to complete its transition. Breathing is especially powerful here. Slow breathing with gentle, longer exhales activates calming pathways. It signals safety. It allows blood vessels to relax. It reduces the secondary adrenaline surge that often follows the initial hormonal rise. You do not need to control the breath. Simply slowing it is enough. The fourth principle is to avoid chasing numbers in the dark. Measuring blood pressure during early morning awakenings often increases fear without providing useful information. Unless specifically instructed by a healthcare provider, delaying measurement until later in the morning is usually safer and more informative. This delay allows the body to stabilize. It prevents fear-driven spikes. It provides readings that reflect baseline function rather than reactivity. Trust patterns, not moments. The fifth principle is to stabilize daily rhythms. Regular wake times, consistent meals, and predictable routines strengthen the internal clock. When the clock is stronger, transitions become smoother. After 60, the body depends more on external cues to maintain rhythm. Providing those cues consistently reduces timing errors that lead to spikes. This includes morning light exposure, daytime movement, and regular social interaction. These signals reinforce the day-night boundary. The stronger the boundary, the gentler the transition. Another important principle is emotional reassurance. Fear is one of the most powerful amplifiers of blood pressure spikes. Understanding that early morning surges are common and often temporary reduces fear. When fear decreases, the nervous system becomes less reactive. Blood pressure settles more quickly. Reassurance is not denial. It is informed calm. If symptoms are severe, persistent, or accompanied by concerning signs, medical evaluation is important. Safety always comes first. However, most early morning spikes fall within the range of physiological variation rather than emergency. Knowing this allows you to respond appropriately rather than reflexively. Medication timing may also play a role. Some blood pressure medications are designed to protect against morning surges. If early morning spikes remain frequent despite supportive habits, discussing medication timing with a healthcare provider may be appropriate. This should always be done with guidance, not self-adjustment. The goal is alignment, not escalation. One of the most overlooked aspects of reducing early morning spikes is patience. The nervous system does not change overnight. Patterns that developed over years take time to soften. Each calm response trains the system. Each supportive night reduces reactivity slightly. Over weeks, these small changes add up. Many seniors notice that awakenings still occur, but they feel less intense. Blood pressure still rises, but not as sharply. Sleep resumes more easily. Mornings feel steadier. This is progress. It is also important to remember that aging does not mean loss of regulation. It means regulation requires more support. The body remains capable of balance when given the right conditions. Reducing early morning blood pressure spikes safely is about creating those conditions. Calm evenings, supportive sleep, gentle responses, consistent rhythms. Together, these habits work quietly in the background, smoothing transitions and reducing strain. If there is one message to carry forward from this entire video, it is this. Early morning blood pressure spikes are signals, not threats. They signal a sensitive transition. They signal a need for support, not alarm. When you respond with understanding rather than fear, the body follows. If you're over 60, don't try to solve blood pressure one video at a time. Subscribe and watch the next video in this series right now. We focus on calm, clear guidance for seniors' health, blood pressure, and safe daily routines after 60 without panic and without extremes. Thank you for taking the time to understand your body more deeply. The way you respond during the quiet hours shapes the health of your days far more than most people realize.